Hello, my name is Lucy Whelan. I am studying nursing at ACU, and my student number, I'm not sure if I'm meant to give it to you, but it's SOO188400. So for my vodcast today, I'm going to be doing diabetes, so type 2 diabetes, and my patient, I'll get straight to it. My patient's name is Janice Joplin. She's a female, she's 52 years old. Her condition is type 2 diabetes. She is overweight. She does minimal exercise, but the exercise she does do is gardening, and she takes her dog for a quick walk around the block when she can. She is an accountant, but it's a very sedentary job, so she doesn't move around much. She's divorced and she has 2 kids who live out of home but are within a half an hour to 40-minute drive. Her family medical history is that her mother also had type 2 diabetes. She's not pregnant. She's not a smoker anymore, but she was. And her alcohol intake is only on special occasions, so like at a birthday or something, she'll have a couple of glasses. And the medication she's taking for type 2 diabetes is metformin. Okay, so for the first question regarding to diabetes, I chose to talk about insulin binding to the target cell and insulin release. So in a healthy non-diabetic person with insulin binding to the target cell, insulin is a large peptide molecule, and in a healthy person, insulin binds to an insulin receptor on the target tissue, which could be fat, liver, or muscle. The receptor-bound insulin triggers certain GLUTs, and the GLUTs will pick up the glucose from the blood, causing a decrease in blood glucose levels. Whereas in a diabetic person, so a person with type 2 diabetes, there is not enough insulin being produced. Therefore, it cannot trigger the transporters or the GLUTs to pick up the glucose from the bloodstream and bring it to the tissue. And sometimes insulin is unable to activate GLUTs if insulin resistance is occurring. Okay, so for a healthy person, insulin release, is released from the pancreas, and it is triggered by an increase in blood glucose levels. Insulin secretion is a biphasic process, meaning it has 2 phases, and the first phase is rapid and really quick releasing, but the second phase is longer, and it takes longer to occur as more insulin has to be made before it can be used again. For a diabetic person a person with type 2 diabetes, there is insufficient secretion of insulin from the B cells of the pancreatic islets, causing impaired insulin action in the target tissue. So because of this, hyperglycemia can occur when insulin secretion is unable to compensate for insulin resistance. Okay, so for consequences of long-term hyperglycemia, I chose stroke and renal disease. And with stroke, if you have type 2 diabetes, the chances of having a stroke is going to increase anyway. But over time, high blood glucose levels can lead to increase in deposits of fatty material on the inside of blood vessel walls. This is called atherosclerosis, and atherosclerosis causes narrowing of vessels, which can lead to blood clots getting stuck and cutting off the oxygen supply to the brain, which can then turn or cause a stroke. I drew a picture. I don't know if it's going to work. So here is the blood vessel. The dark orange is the atherosclerosis, and here is the blood clot that is stopped. Blood caused a blockage, and so no more blood and oxygen can get up to the brain. So renal disease is also a long-term effect of hypoglycemia, and when our bodies digest the protein we eat, the process creates waste products. In the kidneys, there are millions of tiny blood vessels, which are also known as capillaries, and these capillaries have tiny holes which filter out the waste and allow the blood and protein and nutrients to continue through. So high levels of blood sugar make kidneys filter too much blood, and all the extra work is hard on the kidneys and the filters, and it puts pressure and stress. So after many years they start to leak and the useful proteins are lost throughout the filters. Eventually the kidneys lose the ability to filter at all, which allows accumulation of waste in the blood. And that causes renal failure. And last but not least, the last question 3, was which drug do we use to help people with type 2 diabetes? And it is metformin. I didn't realize or take into account that the words would be back to front. That's my fault, so yes. Metformin is used to treat patients with type 2 diabetes. It helps control blood sugar levels and does this by working to restore your body's proper response to insulin that you naturally produce. It also decreases the amount of sugar your liver makes and that your stomach and intestines uptake. So it prevents stroke and kidney failure, like the 2 consequences I talked about before, and it should be taken with a proper meal and exercise regime. And yeah, I think that's it. Thank you for listening. I hope it was interesting a little bit. Anyway, thank you.